started. Again, thanks for everybody attending today. This is an interesting situation doing everything over a webinar, but I'm happy to meet everybody. I will start by introducing myself. I am Dr. Jen Swiderski. I go by Jen. I am a board certified surgeon, became board certified in 2008. Throughout my career, I have volunteered with numerous rescues, humane societies. I've taken trips to Mexico for spay, neuter, health things for animals that also benefit people, and really enjoyed those. I have also taught quite a bit to various levels: students, interns, residents, technicians, as well as I've given lectures to the general public. I've enjoyed these experiences, and I love to be able to combine these in this program we're about to go through with you guys. And then Dr. Steve Rubin is head of CAVT, and I will let him introduce himself.
Well, hello there. I'm Dr. Steve Rubin, and I run the Colorado Academy of Veterinary Technology, which is here in the southwest portion of Colorado Springs. This is the oldest and largest program of its sort in Colorado Springs. We've been training veterinary technicians since 2007, and we've got many graduates and a lot of very happy alumni. We run a full 2-year veterinary nursing program here, and we are really thrilled to have Jen on board with us, because we're going to be able to offer our students a very unique and exciting opportunity to participate and observe and advance surgical procedures. And there's going to be huge learning potential from that. So, and just a tiny bit about myself. I'm a graduate of Cornell and the Colorado State University College of Veterinary Medicine and Biomedical Sciences. I spent my entire clinical career as an emergency clinician, doing the medical side, not the surgical side. And then I was tapped to start the program here about 15 years ago, and was happy to do it. So anyway, here we are. Anyway, Jen's going to go ahead and explain the way we're going to operate this surgical program.
Right. So as Steve said, our main goal with this program is to offer low-cost advanced surgeries for rescues. This has many advantages for the rescues, but it allows me to partner with the tech school and allows me to teach as well. How it works, essentially, there is a link that you guys should have. If not, certainly reach out. You go online and you request an appointment with myself. That appointment is at CAVT in Colorado Springs. Once you have made that request, then I will either call or email you to confirm the day and time. And once you have that, then on the morning of the appointment, you show up at the time. I do recommend fasting just in case we have to sedate the animals. We will go through a physical exam. We will go through any diagnostics that need to be done on that day. We'll go through a bit of paperwork, whether it is a rescue member or a foster. Any of those are fine to bring the animal, but whoever I need to communicate with, I will, as far as the advantages, risks, details about the procedure, as well as follow-up, and make sure everybody's on the same page so that we have the best outcomes for our patients. That is the day of the appointment. After the day of the appointment, you will also have an estimate, and we will look at scheduling a surgery date. On the surgery date, you show up again at CAVT, fasted again, and the animal will need to stay there through the day. They will go home the same evening. Typically, these are on Mondays, so just a heads up on that. Typically, they are Mondays, drop off in the morning, pick up in the afternoon. You will have full written discharge instructions. There will be medications to go home, and everything will be gone over by our techs at the end of the day, and or myself. So it should be pretty clear at the end. Anything that requires additional questions or anything like that, you're always welcome to reach out to myself. You guys will have my work number at the end of each visit, so you're welcome to reach out with any questions. And then you will receive an invoice in about 24 hours from My Company Moves, and then you have a certain amount of time, typically 15 days, to pay that. So that is the details of how it works. The benefits to the pet really are that they get the care they need. They get their procedure so that ultimately they can get their forever home. And that's really what we want. The other advantage is because this is lower cost to you all, that hopefully it doesn't take as long to save up the money or do fundraising. And so we can get these done quicker, and there's less morbidity because we're not waiting as long to provide these services. So ultimately, we're looking at helping you guys get these patients and rescue animals into homes as soon as possible so that they can be with their forever people. So that's the benefits to the pets. Myself, it really gives me a chance to give back, gives me a chance to teach and reach out to a larger community that may not always be getting everything that they need. So I'm happy to help, and that is the advantage for me. There's certainly advantages for students, and I'll let Steve go over that part.
Right. So just to reiterate what Jen was saying about the benefit to, the animals, our patients. We've been doing this for other rescue groups for a long time now, but only as far as spays and neuters and very simple dentistry. We do see much more complicated cases that we just can't handle because it takes too much time, and we have to spend our time teaching. But now with Jen on board, we can devote the energy and focus on these more complicated cases. And so that sort of rescue patient now has an opportunity to get what they need so that they're adoptable, okay, and at a very reasonable price. As far as the patients are concerned, as far as the students are concerned, sometimes I consider them patients. They're so excited about this. These are extremely enthusiastic students. They love what they do. Their dedication is unbounded. And to be able to participate in the sort of procedure and put their skills to work and developing aesthetic protocols, pain protocols, seeing different ways of sort of upping the game, if you will, is only going to benefit them. So, it's a win-win all around.
Yeah, I'm really excited about the benefits for everybody, and having a chance to work with Steve and some of his instructors who I've worked with previously is just so exciting.
Is there an opportunity for us to take questions here?
And it says that the prices, I only got part of that question.
I noticed that the prices you charge are significantly less than I'm used to paying at a traditional referral hospital. How are you able to offer the same procedures for so much less?
Yeah.
I can begin to answer that, but maybe Dave wants to give that a try. Otherwise, I'll do it.
If you want to start, and then I can fill in a little too.
Well, what I'll say is that the school has a lot less overhead clinically than a referral hospital. We don't have to pay for CT scanning here or MRI. We don't have the same number of clinicians here. Obviously, we still have significant costs, but because we're geared up as a teaching institution and technically a research facility, we can charge less. It's pretty simple, honestly.
Right. And from my side, it boils down to overhead. As a mobile surgeon, I have less overhead because I don't have a building with, say, 20, 30 employees or more. And so my overhead is less. I do still use the same equipment as I did when I was at a referral hospital. So the implants are the same as I was using prior. The equipment is all the same. So there's no cutting of corners or anything like that. It is truly very, very good medicine. and your patients are getting the same thing. We just don't have the same overhead, and it allows us to pass some of those savings on to you guys. And that's a great thing for all of us. Mm-hmm. And then it looks like, what happens if there is a complication? Complications are something that you want to contact me directly about. I have my work phone with me pretty much all the time, and the only time I don't answer is if I'm in the OR or something of that nature where I can't pick up, but I answer texts, I answer voicemails back as soon as I can, and then those complications we will deal with as needed, whether it is that we need to meet up or is this something that I need to look at photos. Everyone's a little different. The good news is complications are low. They're very low rate, and I strive to keep my complications below the standards. And so I will continue to do that, but I am here for any complications, and certainly reach out to me. Emergency surgeries. Unfortunately, at this time, we're really not offering emergency surgeries. We just do not have the availability and the resources to be able to move on something really rapidly. So unfortunately, not at this time. If we're able to do that in the future, we will certainly pass that information along. Any other questions? Procedures that are a good fit for this type of situation. There's actually a pretty wide range of procedures that we can do, and that the pets benefit from, that the students benefit from, that I am able to provide in this situation. It can be things like orthopedics. There's lots and lots of cruciate tears out there, patella luxations, FHOs, other things soft tissue wise. We certainly have mass removal availability. There's some availability for brachycephalic surgery. Lots of other things. If there's anything that you had a specific question about, then certainly reach out, and I'm happy to discuss those individual, but huge range of possibilities here. Amputations, lots and lots of things. Yeah. What role does the local vet play in this? Your local vet, or the one that your rescue works with, is an important person in this because we need the information from them. Any diagnostics that have been done from them is great. Occasionally there will be times where we will have to use them if there is a complication, say to have them look at something or prescribe meds, but most of the time I'm going to say reach out to me absolutely first, and if needed I will chat with your vet. They are our front line, and so they are very important in getting all the information to us. And if you want all the records passed along, we can certainly do that as well to keep them in the loop.
Okay.
Any other questions? All right. Well, thank you, everybody. Thanks, Steve. It's good to see you. Long distance today.
Yep.
And we look forward to working with all of you guys.
Okay. Thanks very much.
Thank you.
To get started working with Dr. Jen Swiderski at the Colorado Academy of Veterinary Technology, visit our website at vetmoves.com/refer/Swiderski/rescue. From here, you'll be able to register your nonprofit, submit a case referral, or schedule an appointment. If you have any further questions, please let us know by submitting your information to dr.swiderski@vetmoves.com. That is dr.swiderski@vetmoves.com. We look forward to working with you.